tips to help your child with separation anxiety, particularly when they're going to school. How can we decipher? I'm sitting here with Collett, and she's going to help us unpack and help us handle these situations, particularly with students. You know, we don't know whether they're stubborn or are they being stubborn, or is it separation anxiety? How can we define that?
So we spoke about school refusal before.
Yes.
And it's such a big topic. I actually wanted to revisit this. I wanted to talk about another aspect, which is the separation anxiety.
Right.
We actually call it SAD, separation anxiety disorder.
Right.
And it's not just children being stubborn or, you know, being difficult.
Yes.
When children struggle with separation anxiety, essentially it's because they are afraid of interactions or being anywhere where they are separated from their primary caregiver.
Okay.
And it comes out of fear. So they want to avoid any situation where they think they may be separated from you for good. In other words, you might die.
Did we do something for them to, you know, come this way?
No. A lot of this is to do with personality. You could have 3 children in one family and one child struggles with separation anxiety.
And just wants to be with the family.
Yeah, they just really, particularly in this COVID time, if children have been home a lot, being homeschooled or schooled online, and suddenly schools have to go back, it can exacerbate it for some children.
Okay.
We need to remember we're looking for those 3 signs. So we're looking for the physical, the behavioural and the cognitive.
Okay.
So physical is feeling sick, nausea, headaches.
And they say this to you?
They might say it to you, or you might pick it up as the parent, and you realise this isn't a physiological illness. You realise it's coming from somewhere else. Right. Cognitive is always, I say to my own uni students, it's in your mind or in your brain, your thoughts. And it's that if I go to school, Mum might have an accident. I might never see her again. She might get hurt, or I might get hurt. We'll be separated forever. It's those almost unrealistic what-ifs.
Right.
And then the behaviours are then manifested in refusing to get dressed in the morning, wanting to delay getting ready in the mornings.
Saying they have a headache.
Yes, and then some children will go to school but be called to be picked up early, or they just won't interact at school. They hang on to other adults or teachers. And remember, any kind of school refusal affects long-term relationships, and it affects academically.
Right.
So really what we're doing is we use what we call the ABC model in psychology, something I also teach my uni students. Right. Really, it's just affect, which is your feelings.
Right.
Your B is your behaviours, and C is your cognitive or your thinking. Right. So we're helping children become aware of what's going on in my body and linking it to the feelings that are happening.
Talking to them about that?
Yes, and saying, I'm feeling sick, but I realise it's because I'm actually afraid of going to school. Okay. And so this is what I do. And then giving them other alternatives, other positive ways to become the boss of the worry monster. Right. And so helping them just with much more healthy ways of confronting those fears, and not just looking at the terrible what-ifs, but look at things more realistically.
Right. Thank you so much, Collett, for those great tips. I hope that's helped you. Keep it locked right here at Mums at the Table.